more than 80% of patients visiting a dermatologist are hoping for the dermatologist to advise on skincare with combining a tailored regime. Only 35% will actually get that when they see their dermatologist, which is really quite astonishing, isn't it? There's such a opportunity that's missed, and ultimately patients will leave disappointed if they are hoping for a skincare regime and that is never discussed. But I do appreciate that it can be confusing even for experts, dermatologists even, with regards to choosing the right types of ingredients, because there's a flood of ingredients and the marketing always sounds great, but you don't really know where the evidence is. So I want to, in my talk, drill that down to what is a basic skincare regime that everybody should be on, and what we ultimately want is biostimulation. So we want our fibroblasts to produce more matrix components such as collagen and hyaluronic acid. We also want to prevent excessive breakdown of collagen. So we want to inhibit the MMPs, for example. Increase of epidermal cell turnover, of course, to brighten the skin, clarify. But also with age, your dermoepidermal junction will flatten. So we want to turn that into a healthier, nice wavy shape again, if you would look at it under the microscope. And then there might be in certain patients specific problems like irregular pigmentation, and that also skincare can address very nicely. One of my favorite ingredients in skincare are retinoids. So I will give you an overview of the different types of retinoids now. Retinoids basically just means vitamin A derivatives. There are quite a few of them. And some of them you will ingest with your food. So preformed, proper vitamin A you will, for example, get in liver, fish oil, milk, eggs, etc. And then you've got provitamin A in other foods, which are more plant-based, maybe. But topically, when we treat the skin with topical retinoids, we do that for different indications: aging, pigmentation, acne, and also in medical dermatology with psoriasis patients, for example. So retinoids are very, very versatile, and there are a lot of different derivatives to cater for these different indications. So to give you an overview, retinoid is, as I mentioned, just any molecule based on vitamin A. So that's just a kind of group name for all of them. And then we distinguish between prescription type retinoids and retinoids that are available over the counter. So the gold standard, tretinoin, is the one that has been around longest. People might refer to it as Retin A, although that's just a brand name. And then we've got newer prescription synthetic retinoids, such as adapalene in different cream, tazarotene in Zorac gel, isotretinoin, which we can give orally for acne or topically, also in gel form, and alitretinoin is another systemic synthetic retinoid. And that's fine. For certain conditions, they will definitely warrant prescription type retinoids. However, there's a big need for over-the-counter options for our patients as well. And over-the-counter versions of retinoids are retinol, for example, the most common one, the kind of pure vitamin A. And then the retinaldehyde is also referred to as retinal, and various esters of retinoids. So tretinoin, our gold standard prescription vitamin A, has tons and tons of clinical and also histological and all sorts of scientific studies behind them. And we know it induces collagen 1 and 3, which are in our skin the two most important types. It induces also other matrix components, and it will lower down the degradation of those by, for example, inhibiting MMPs, metallomatrix proteinases, and by inducing TIMPs. So TIMPs are the tissue inhibitors of the MMPs. So if we induce them, that will stop the MMPs from doing their destructive work. We know it even improves the quality of elastin fibers, repairs photo damage, of course, and even has some anti-inflammatory effects on microinflammation that we do know now is connected to a lot of skin issues, including aging, including melasma. So anti-inflammatory effects is always a plus in skincare. And how does tretinoin work? Well, tretinoin has its very own receptor. So the tretinoin molecule will penetrate into the cytoplasm, and then it has to actually penetrate into the cell nucleus because the tretinoin or retinoic acid receptor sits in the nucleus. There are other prescription retinoids. One of the most commonly alternative used ones is called Differin, contains adapalene. And that's also increasingly used for photo damage, especially in the UK, where unfortunately the Retin A was taken off the market, not for any for reasons of concerns about it. It must have been just to do with the company or the production of something. So we in the UK, in the chemist, have only a combination of an antibiotic with tretinoin for acne patients, but we don't actually have a pure tretinoin. So I order mine in from Germany. But a lot of other doctors use Differin as an alternative, and there is certainly emerging difference on adapalene for matrix remodeling and also other retinoids like Zorac gel, which is very, very irritating though. One of the problems we have with all of the prescription retinoids is irritation of the skin. So that's an irritant contact dermatitis, and very often a patient might come back and report, oh, I'm allergic to that retinoid. Very important to realize this is not an allergy. It's a simple irritation, and it simply means they use too much too quickly. So we go back to the drawing board, stop for a few days, and then increase much more slowly. And some patients might just get to twice per week, which is absolutely fine, whatever their skin tolerates. But this is certainly a concern, especially for the prescription retinoids. So this is where over-the-counter retinoids really show their strengths, because they are significantly less irritating. And we do have now really good studies that show that they can also remodel the dermis and repair photo damage. So this is retinol, our vitamin A molecule I mentioned earlier. So how does retinol actually work in the cell? Because retinol doesn't have a receptor. There's no retinol receptor. So what has to happen is that the retinol penetrates through the cell membrane into the cytoplasm, and in the cytoplasm it is actually transferred into tretinoin, into retinoic acid, because we only have that receptor. So you see that the retinol from over-the-counter products will dock to exactly the same receptors as our prescription ones do. They just do that at a slower pace because of the various steps that are needed to get there. And these are the steps specifically. So we're starting off with all of the esters, and the esters are very, very common in over-the-counter skincare that you can just buy off the shelf. Just go into Boots, grab anything without any expert advice, and they are very gentle. I don't want to say doesn't work very well, but certainly that they are the mildest form, and that's why they are usually included in over-the-counter products that don't come with advice attached to them. And then the next step is this molecule is then transferred into a retinol, after that into the retinaldehyde, and ultimately will form our retinoic acid. So several steps. And because you always lose a little bit with every step, and you delay also the effect, that's why the retinol here is much more gentle than the retinoic acid, although they do have their effects via exactly the same receptor in our nucleus. And if you look at the benefits from clinical studies, you will see that the retinol induces fibroblasts to stimulate to produce more matrix components. They also inhibit MMPs. They also increase epidermal proliferation and turnover and inhibit the pigment formation enzyme tyrosinase. So really, if you compare that to my earlier slide about the tretinoin, it's very similar, isn't it? Which is not surprising if it has the same receptor. But there are now, and up to recently, there weren't that many good studies on retinols clinically in aging. But now we do have some good studies. So let's start with the kind of baseline. In the study, retinol outperforms vehicle. So that's, I think, our minimum requirement. But it's good to know that it does. But all these other points you see here, they are all taken from studies. I've just mentioned a few here, but there are many more. And you will see that the studies have caught up on our over-the-counter vitamin A derivatives. So they really are something that we can recommend with a good conscience as an alternative for somebody who might not maybe wants to come in so regularly to renew their prescription, or somebody who finds the prescription ones too irritating. So we have had retinol around for quite a while, and it's still an amazing compound, but cosmetic science is now looking into how can we combine that molecule that we know so well from studies to make it even more effective. And one of the combinations that have been looked at is a combination of retinol with N-acetylglucosamine. It's also known as neoglucosamine or NAG, so it's very confusing because they are essentially exactly the same thing. They're just different names for the same thing. And NAG is a precursor of hyaluronic acid. And hyaluronic acid, we know, binds a lot of water, 1,000 times its own weight. But not only that, it actually helps with cell communication as well. So that's a very important factor in HA and why we really want to have a good HA content, even in older skin. HA also has nice skin plumping effects because of the water holding capabilities, and you can see that on this image. So that's pre-treated with NAG, and that is non-treated, and you can see the plumpness and thickness of the skin purely caused by holding more water, so much more pliable. Unfortunately, our HA reduces with age, and also the quality of our HA declines with increasing age. And now I have to tell you something which won't be good news. I know probably all of you are using topical hyaluronic acid serums, and some of them fragmented into tiny parts. And what they do is they work really well for hydration of the stratum corneum, but they do not penetrate into the dermis. Even the fragmented ones will not replace your natural hyaluronic acid. That's unfortunately a fact. So the only way to increase our dermal hyaluronic acid is to somehow convince your skin to produce more of its own accord. And NAG is exactly that. So NAG does penetrate and has been shown in this study to increase HA synthesis of our inhabitant fibroblasts by more than a third, which is actually huge. And there was a very interesting study done with NAG on its own. So this is not a combination, but it was just 8% NAG cream used twice per day on the face, and there were some additional experiments on the arm with 3 times daily use in women with mild to moderate sun damage. The evaluations were both subjective by an expert grader and also objective with pinch recall to test elasticity, and also the measurement of skin thickness with calipers. This was a 12-week study, and you can see the expert grader here, the dermatologist, showed that after 12 weeks there was an improvement in virtually every single parameter looked at. So this goes from skin clarity, where pigmentation is improved and cellulosis is improved and the clarity is improved, down to actually improving fine lines and wrinkles and pore size. So this is with only the NAG, 8%. The pinch recall test showed also, this is in vivo, of course, the study I mentioned, a good improvement of skin elasticity and the plumpness of the skin, the hydration, the deep hydration has also improved very nicely with this NAG cream. Silicone replica are used to look at the skin surface, so they are similar to the dental impression materials. They are applied to the skin and then they are analyzed digitally, and we can then measure exactly how deep the wrinkles, for example, are, or how bad the roughness of the skin is. And in this study, we saw that the NAG cream did improve the skin surface as well, with reduction of roughness of the skin and with improvement of wrinkling. So we know now NAG is great for aging skin, but it is actually also very useful as a topical ingredient for acne-prone skin. This was another study done, a double-blind control study, which is the kind of best type of study that we like to see in mild to moderate acne. And I think one of my colleagues mentioned this study yesterday already. So this was a comparison between an 8% over-the-counter NAG cream and a 10% BPO benzoyl peroxide. If any of you have ever used benzoyl peroxide, you will know it's incredibly irritating, much more so than even prescription tretinoin. And especially in a 10%, I mean, if I ever prescribe BPO to my patients, I usually do 4, maximum 5%, but 10% is extremely irritating. And this was applied twice per day. And what you see here, that although the BPO worked slightly stronger, which is not surprising, it's such a strong topical agent, the NAG cream, which comes with much less irritation, has a quicker response and a nearly as strong response as the BPO cream in 10%. And this is the data to show that it really has much, not much irritation as well at all. So the patients reported it was not drying and it did not sting or burn, very much in contrast to the 10% BPO cream. NAG is a non-acidic ingredient, and that's why it is not so irritating. It has a significant anti-aging and anti-acne effects, and it also gives a very gentle, lovely exfoliation effect. So what if we now combine those two amazing ingredients in one cream? And this is, I just want to really talk a little bit about the combination of those two, a retinol and an NAG molecule in one product. This is a study which shows that the HA production increases compared to control with a pure NAG cream, also increases nicely with a retinol cream. So you see that effect is actually very comparable in degree. But if you now mix them both together, you not only add up those benefits, but you have a higher than additive benefits. And that's because they work in synergy. Those two ingredients are really great synergistic ingredients because they both can improve HA production and improve wrinkles and all of the things I mentioned, but they do that via different receptors in the skin. And that's because they have those different mechanisms of action. That's how they work so nice in synergy, and you get more than an additive effect. So in summary, retinol is still the over-the-counter gold standard of matrix induction and biostimulation. And a combination with a symbiotic ingredient such as NAG can further improve the clinical benefits. And NeoStrata has a cream that contains exactly those two ingredients put together, and I've used it myself. I recommend it to patients as well. And what I see, I know we don't have a study yet comparing it to tretinoin, but clinically, which is anecdotally, but certainly I've got the impression that it works just as good, if not better, than tretinoin for aging symptoms. So coming back to my first slide, knowing a little bit about evidence-based ingredients, we should really try and bring this number up. And it's not only the dermatologists, it's also aesthetic doctors, aesthetic nurses, estheticians. And one thing I found in my clinic, we talked a little bit earlier about how we advise on skincare and how we sell skincare. And one little trick that I want to share is put a desk in your medical esthetician's treatment room. So when the patient comes in, they're starting behind the desk, which automatically puts them in a position of authority. And they initially talk about the skincare and then bring the patient onto the couch and start the treatment. And I found that in my clinic to be incredibly powerful to stop patients from going to John Lewis and getting the next best space cream, and just really realizing that they have been talking to an expert. So if we summarize that in a basic skincare regime that everybody should be on, it would be very simple. And you can always add to this as time goes on. But if it's a patient who's maybe new to cosmeceuticals, put them on this regime. We need a high-grade antioxidant serum in the morning. This is to fight free radical damage, which we acquire from sun exposure, from even infrared, which is the heat irradiation from the sun, pollution, all of these things, even our own cells produce free radicals in their breathing mechanism. So high-grade antioxidant serum is an absolute must for everybody. On top of that, we will apply an SPF, and I always recommend between 30 and 50, but that's simply because people often don't use enough of it. I love the NeoStrata physical protection, which is an SPF 50, so that's my favorite one out of that brand. And it doesn't give you that kind of chalky appearance because it has a nice little tint. In the evening, everybody should be on some, or let's say everybody from end 20s onwards should be on some form of matrix stimulator. And we want to induce both collagen and HA. So a combination of retinol and NAG, for example, would be a really good evening regime. You have to tell the patients, though, that they cannot start that every day from the start. They have to taper it in. Anything as powerful as this has to be tapered in and treated with respect that the cream actually deserves. So what I always say is start with once or twice per week for a couple of weeks, then go up to every other day for another couple of weeks, because if you have an irritant reaction, it will come with a delay. So if they apply the cream in the evening, next morning, fine, no flaking, no redness, and then they apply it again that evening, you could still be developing the irritation from the first application. So definitely wait at least a few days. I always say 2 weeks and then go up to your next level of usage. And also by that stage, the NAG, which takes a little bit longer to have an effect in the skin than the retinol, has started kicking in. And that will actually help reduce the irritation potential of our retinol. Some patients do use it every day because they tolerate it absolutely fine. They've got robust skin, maybe oily skin. Other patients might just tolerate it twice per week. And we just have to reassure the patients that's absolutely fine. Even if you just use it twice per week, you will still get benefits because your skin is responding particularly responsive to it. So that's really my last slide. This is what I would like to be everybody on. And it's a very straightforward, it's just 2 steps in the morning, 1 step in the evening plus cleansing. So there's really no excuse, not even from our male patients, to not use this type of regime. Thank you.